Hi, welcome back. I'm Rachel. Today we are focusing on the basics of oral hygiene, which is brushing and flossing. Did you know that about 16.6% of people do not go to the dentist regularly? So that means that what you do at home is the most important thing that you can do. There is a right way and a wrong way. The best way to be brushing your teeth is to make sure that you come in at a 45-degree angle so that those bristles are touching your gums. You want to massage those gums gently. Don't go back and forth like you're sawing, because then you're just going to hit the high spots. You want to get those bristles into those little nooks and crannies. What you want to make sure is that you're not sawing with that toothbrush. If someone can hear you in the next room brushing your teeth, you are brushing too hard. So the next thing is you want to choose the correct toothbrush. Do not get hard or medium. Those are too hard. Those are great for cleaning the grout in your bathroom. You want a soft or an extra soft toothbrush. You want it to feel like a massage, not a scrub. Next is, I get the question of what kind of toothpaste should I use? What I tell people is use what you like. It doesn't matter if it's the newest, greatest nano hydroxyapatite or if it's fluoride free. You need to use something that you like. There's different flavors out there. It doesn't matter what brand. Again, it's what you like. If you don't tolerate foam well, there are non-foaming types. Some people are allergic to SLS, sodium lauryl sulfate. Um, there are products out there that are SLS-free. Next is, how much of that toothpaste do you need? You do not need to swipe the whole brush with your toothpaste. You need just a small pea size amount. So you just need to put a small amount on your toothbrush. Some toothpastes are over foamy, and people who gag have really a hard problem with that. So I would stick with the non-foaming or even less of a toothpaste if it foams a lot. So our next step is flossing. No one likes to floss until you get into a routine. And then you find out how much better your mouth feels and how much better your breath is. What we don't understand is that that little cup of gum tissue around your teeth, it is not attached, and bacteria gets caught down in that area. So you want to get the floss all the way down underneath that little point of gum tissue. I know it's tender. It's tender because you haven't been doing it. It will get better. Just like going to the gym. The first time you go to the gym, your muscles are really sore. You keep going back and it gets better. You have to look at it like having a splinter. If you have a splinter in your finger and you don't get it out, it gets infected. So your gums can get infected from the bacteria. So you want to take that floss, go down below that where those teeth touch. You want to wrap that floss around your tooth like a C. You want to get as much surface area of that tooth as you can. Go down underneath the gum, scrape up and down, and then pull it straight out. If you can't pull it straight out, pull it off to the side. It's okay. Don't forget, you want to get both sides of each tooth. That means even the very last tooth in your head, you need to get on the very back side of that. If you will wrap the floss around your middle fingers like a spool of thread, use your index fingers and your thumbs to hold the floss about an inch apart, then you can reach the back teeth and you're not trying to stick your whole hand in your mouth. That is probably one of the biggest complaints I get. Okay, so all of my patients are saying, I want to use a floss pick because it's easier. It is easier. It is more convenient. But the problem is those floss picks are so straight. It's hard to get that curve. And what you'll do is you'll clean out that little piece of food between your teeth, but you're not getting that sticky bacteria that's adhered to the tooth. If that is left, then you can get an infection in your gums. It's called gingivitis. Gingivitis is completely reversible if it's taken care of. You need to get your teeth cleaned on a regular basis. Then you also need to be doing your home care. We hygienists can work ourselves to the bone, but it's what you do at home. It's your homework that makes the biggest difference. Some signs of gum disease are bleedy gums, swollen gums, gums that hurt. Bleeding is not normal. If you have bleeding going on, that is a sign of infection. If your hand bled when you washed it, you would know there was a problem. Same thing with your gums. Just because we're poking around on your gums, we're not making them bleed. They're bleeding because they are not healthy. Well, that's about it. Again, I'm Rachel. I'm a hygienist here in Knoxville. What you want to make sure that you're doing is that you're brushing well, you're flossing, and you're taking good care of your mouth because these teeth are meant to last you for a lifetime. So if you have any concerns about your mouth, please call a local clinician and have them get you in to check your mouth out. If you have any concerns for yourself or for someone that you are caring for, then please call a dentist and get in and be seen soon. If you think this video has given you some good information, please like, share, and subscribe.